I'm David Krag. I'm a surgeon, a cancer surgeon. I work with a team of researchers at University of Vermont and other institutions in the United States and outside the United States. Our goal is to use a person's own immune system to treat their cancer. I previously developed a technique of identifying the lymph nodes that drain a cancer, that are the first place that the cancer cells may go to. This involves a radiotracer injection around a cancer, like for breast cancer, an injection is made into the breast, and that travels via the lymphatics to the first encountered lymph nodes. We can biopsy those 1 or 2 lymph nodes and determine whether cancer has spread or not. And that's a lot better than the old technique where just all the lymph nodes were radically removed. So we've gone from this radical procedure to biopsying a few lymph nodes. This technique is now standard of care around the world, and well over 1 million women have had this procedure done. Well, now we're taking advantage of this ability, this new ability to locate lymph nodes to develop immune therapies, because in the lymph node is the location where all the immune system starts to begin, and there is an immune response by everybody to a cancer. So we use the radiotracer to identify the lymph node draining the cancer or a cancer vaccine, and we remove that through a small incision. Once we have that lymph node out, we can take it to the lab and we can work with those special cells in the lymph node. Now, what are those cells? Those are cells that have learned how to make anti-cancer antibodies. This is a big deal. In the body, anti-cancer antibodies are produced, but they're suppressed. There's just not very much of them produced. But in the lab, we're able to grow up these antibodies in really an unrestricted manner, and we should make almost unlimited amounts. Then we should be able to give those back at high levels to the patients to make their cancers go away. Well, how toxic should this be? How much side effects should there be? Well, antibodies are a normal part of our blood, and these are a patient's own antibodies, so they're not by themselves harmful or toxic. So we're hopeful that there would be very few side effects related to this. Well, we're very close to beginning clinical trials, and Kat Bordy, Linda Krag, Carrie Clement, and a team of others have worked together to develop support for our research to bring this as quickly as possible to patients. And the idea is that this would be a non-toxic treatment, and that's the cast-off chemo. That's what this website introduces you to. So we hope that you'll be able to join with us and bring this as quickly as possible to patients and develop a new therapy that would be non-toxic to patients. So thank you very much.